As a disclaimer, the information presented in this video is based on our plan's in-network coverage. We are going to walk through a comparison of the two medical plans offered and highlight a few key differences. Both plans provide coverage for essentially the same benefits, but there are two exceptions to note. The high deductible PPO does not provide coverage for orthodontic surgery and treatment or cochlear hearing implants. For more information, you should consult the detailed plan comparison chart available online or contact the benefits hotline at 616-331-2220. One of the best ways to manage your overall health and keep long-term health care costs down is to stay on track with your age and gender-appropriate preventative care. Both of GVSU's plans cover 100% of the cost of preventative care. There are no copays and no maximum dollar limits. The plan will pay for the service as outlined in the preventative care guidelines found on your webpage, so there really isn't any reason not to go and get your appropriate preventative care each year. A deductible is a specified amount of money that you pay before the plan will pay for covered expenses you use. When you pay for services covered by the medical plan, these expenses apply toward the deductible. It is important to note that in-network claims count towards the out-of-network deductible and vice versa. The deductibles are not prorated for mid-year entrants. The in-network deductible for the standard PPO plan is $250 for single coverage and $500 for dual or family coverage. The in-network deductible for the high deductible plan is $2,000 for single coverage and $4,000 for dual or family coverage, and includes your prescription medications. In the high deductible PPO, any person or combination of people covered must have $4,000 in expenses before the plan will pay. For example, if you have not had any expenses and one individual in your family has $5,000 worth of expenses, the first $4,000 would meet the deductible, and then the plan would pay 100% of all expenses on any person covered for the balance of the year. A copayment, or copay, is a fixed amount for a covered service, paid by you to the provider at the time of service. The standard PPO has copays for office visits and prescriptions. The high deductible PPO only has copays for your prescriptions, and they start after you have met your deductible. Coinsurance is what you are responsible for after your annual deductible has been met. The standard PPO has 90% coinsurance after the deductible. That means the plan will pay for 90% of in-network medical expenses, and you will be responsible for the remaining 10% after your deductible has been met. When you reach the coinsurance maximum, your 10% share of the expenses will stop. The coinsurance maximum for single coverage is $1,000, and the coinsurance maximum for dual and family coverage is $2,000. The high deductible health plan has no coinsurance for in-network benefits, and any out-of-network benefits will be higher. GVSU's prescriptions are managed by CVS, but you could go to nearly any pharmacy. If you have ongoing maintenance medications, you can receive a 90-day fill at your local pharmacy or through mail order. Register online with CVS at caremark.com to take advantage of the convenient mail order option and access a number of online tools. A reminder that you must pay a copay for prescriptions if enrolled in the standard PPO. If you are enrolled in the high deductible PPO, the cost of your prescriptions counts toward meeting your deductible. Once the deductible is met, copays for each prescription will be applied up to the annual limit. The out-of-pocket limit is the most you could pay during a year for your share of the cost of covered services. Out-of-network maximums will be higher. A premium is the amount you pay to be covered by the plan. Premiums are deducted from your pay, and you are required to pay the premium regardless if you use the services provided by the plan or not. In the high deductible PPO, there are no per pay period premiums. If you enroll in this plan, you will receive a one-time GVSU contribution to your health savings account of $300 for single or $600 for family. Let's take a moment to review a must-pay or might-pay scenario to compare the cost of the two plans. The dark blue shaded box above, the GVSU Standard PPO plan, is the must-pay portion. This is the amount that you must pay Grand Valley in the form of payroll deduction premiums. This will be deducted from your pay regardless if you use the actual benefits of the plan. The light blue and gray shaded boxes are the might-pay portion. The light blue portion is the annual in-network deductible, and the gray portion is the coinsurance maximum. Now let's focus on the dual coverage comparison. In a worst-case scenario, say if you've had a very bad year health-wise and you were enrolled in the standard PPO with dual coverage, you would have an out-of-pocket liability of $5,356. That includes $2,856 worth of must-pay premiums, the $500 deductible, and a $2,000 coinsurance maximum. Even after you have met your deductible and coinsurance maximum, your out-of-pocket expenses will continue to rise as you will still be responsible for copays for office visits and prescription drugs. Now take a look at the high deductible PPO. Since there are no per pay period contributions for this plan, everything is might pay. As long as your services are in-network, the most you will pay out of pocket for dual coverage is $4,500. That includes the deductible of $4,000 and pharmacy copay of $500. After that, the plan will pay 100%. The Priority Health Member Portal offers a number of tools to keep you informed and save you money. Through this, you can make an appointment with your physician, access your wellness portal, check your deductible, schedule a visit with Spectrum Health Now, and even check pricing for procedures using the Cost Estimator tool, and earn rewards for choosing the procedures with the best value. Another resource for you to consider is the Spine Center of Excellence, available for people who are considering spine or back surgery. The program requires the member to visit one of the identified centers of excellence to speak with a physician to determine if surgery or other less invasive methods are needed. As a reminder, the standard PPO and the high deductible PPO do not provide benefits related to an automobile accident. This is covered by Michigan's no-fault insurance. If you are currently enrolled in either GVSU plan, be sure to inform your auto insurer when renewing that your medical plan does not provide coverage. If you are an active GVSU employee and enrolled in one of Grand Valley's medical plans, you and your spouse are not required to enroll in Medicare on your 65th birthday. Medicare allows you to stay enrolled in our medical plans until you retire. Once you retire, you may elect Medicare without penalty and without having to endure the waiting period. For more information, review the Medicare information section on our website. If you are 65, please note that if you start your Social Security benefit, you will automatically be enrolled in Medicare Part A. Since Medicare Part A is considered other medical coverage, you will not be able to continue making contributions to your health savings account, but are still eligible to be enrolled in the high deductible PPO plan. For more information, visit our retiree benefits website.